anti-gliadin high when my patient is gluten-free. I'm Dr. Amy Rolfson, naturopathic physician and part of the clinical team here at Diagnostic Solutions Lab. And I want to tell you what I do next. So in my work, I see this all the time. Patients perceive themselves to be gluten-free, and yet anti-Gliadin IgA is still high. Maybe it's their first test, maybe it's a follow-up. This can be for a number of different reasons. First would be cross-contamination. Your patient is actually getting exposure to gluten within the diet. In very sensitive people, even tiny traces of gluten or gliadin can trigger an antibody response, especially if they're eating out, using shared toasters, or not reading labels closely. Second, cross-reactivity. Even if you're not getting traces of gluten, the immune system may perceive traces of gluten. The immune system may be reacting to other proteins that are similar to gluten, like dairy, corn, rice, or oats. Even candida can elicit an anti-Gliadin IgA response in somebody whose immune system is overreactive. Third, the gut itself. If your patient's GI tract is in a state of inflammation, dysbiosis, even insufficiency dysbiosis, or heightened permeability, this all may result in a heightened antibody response to gluten or gliadin, and this may persist beyond when gluten is removed from the diet. For my strictly gluten-free patients, I always add the add-on test fecal gluten peptide, and in cases like this, it can be an extremely high-value clinical add-on. This assay measures the content of gluten or gliadin within the stool and can tell you if your patient has had gluten sneak into their diet in the past few days, which can help differentiate between cross-contamination and cross-reactivity. Just remember, fecal gluten peptide picks up gluten that has been in the diet within the past approximately 2 to 3 days, whereas anti-Gliadin IgA can stay elevated for months after a gluten exposure. So time it carefully if you're running this. So yes, anti-Gliadin IgA can be high even without gluten exposure, but there might be a sneaky gluten exposure your patient doesn't know about. Use the fecal gluten peptide add-on for your patients who are strictly gluten-free, just in case their anti-Gliadin IgA comes up super high. It always helps to look at more of the picture to give you more information in cases like these, so you can tell the difference between sneaky gluten cross-contamination and something a bit more complex. If this has been helpful, consider liking, sharing, subscribing, and if you have any clinical questions, comment below and we'll do our best to get to them. Thanks for joining me.